Good afternoon. We are so glad to have you with us today. So, we are kicking off the fall series that we have for Envisioning Equity, if you will, in terms of what we are looking at today. We did this last year and it was such a success that we wanted to do it again this year. So, we are really excited about being able to do that today. So, welcome to each one of you who is with us today. We will be recording this session, so you'll see probably on your screen that it says that we're recording, so please be aware of that. Also, if you have questions, there's a little place at the bottom of your screen where it says Q&A, and if you would put those questions into that section, then those will be answered near the end of our event today, and so they'll be entertained as a part of our closing today. The other thing I'd like to invite you to do is to listen carefully as you'll hear our speakers for the day talk about equity. They'll talk about health disparities and health inequities. I don't want to define that for us because we all have a different view of that, and we could say this is our view, but I'd like for you to think about, as you hear our speakers today and they use these terms, how you might hear that in terms of your particular context. So again, those terms are equity, health disparities, and health inequities. Our moderators for the day are going to be Dr. Lauren Barron. Dr. Barron serves as the DeBakey Chair over in Medical Humanities. She's the inaugural chair of that area. They are one of our sponsors also in terms of arts and sciences and medical humanities section of our university. They, along with the School of Social Work, the Dinah Garland School of Social Work, and then also the Center for Church and Community Impact, along with External Affairs for Baylor University, are our sponsors for today. But Dr. Barron will be one of the moderators that we have for our time together today. So welcome, Dr. Barron. Then we also have Dr. Stephanie Body, who will be with us as the co-moderator. And Dr. Body is with us in the School of Social Work. She also teaches at Truett Seminary and also in the School of Education. She is assistant professor, and she is the assistant professor in terms of church and community ministry. So Dr. Body, we welcome you in this role of being co-moderator. So Dr. Body, I'm going to turn this over to you. And again, welcome to each of you who's with us today. And we appreciate your attention today and your time that you're investing to be with us today. Dr. Body.
Thank you, Dr. Yancey. We're excited today to have with us Commissioner Patricia Miller. She began serving at the McLennan County as the McLennan County Commissioner for Precinct 2 on January 1, 2019, and she's the first woman to be elected to the McLennan County Commissioner Court and the first African-American woman to serve on the court. Prior to being elected, she served the constituents of Precinct 2 and McLennan County as Commissioner Lester Gibson's administrative assistant for 23 years. Patricia Miller, the middle daughter born to Mr. and Mrs. John and Arthur Lee Chisholm, was born in Brooklyn, New York. And at the age of 10, she moved to Waco, Texas, and has been a resident of our community ever since. Her long history of community service and civic engagement has shaped her personal philosophy. The more challenging the test, the greater the opportunity for bold and purposeful action. The recipient of the Omega Psi Phi Fraternity Incorporated Omicron Upsilon Chapter 2020 Omega Phi Psi Citizen of the Year Award, the Delta Upsilon Zelta Chapter of Zeta Phi Beta Community Service Award for Governmental Affairs, and the 2018 Sigma Gamma Rho Sorority Lady of Distinction Award. She currently serves on the McLennan County Investment Committee, McLennan County Employees Federal Credit Union Board of Directors, City Center of Waco Board of Directors, Waco ISD, GWAMA Business Advisory Board, and the City of Waco Animal Welfare Advisory Board. She is the past vice chair of the Community Race Relations Coalition Board of Directors and has served as a member of the Eastern Waco Development Corporation Board of Directors, Compassion Ministries Board of Directors, United Way Allocations Committee, and the Women's Resource Center Advisory Board. Married to Robert Miller Sr., she is a mom, a grandmother, great-grandmother, and last but not least, loving aunt. Her favorite quote from Winston S. Churchill is, "To every man there comes in his lifetime that special moment when he is figuratively tapped on the shoulder and offered a chance to do a very special thing, unique to him and fitted to his talents. What a tragedy if that moment finds him unprepared or unqualified for that which would be his finest hour." We're so glad to have with us today Commissioner Miller, who is always prepared to serve. Thank you.
Good afternoon. And thank you, Dr. Body, for that beautiful introduction. I would like to thank all of the organizers and partners of this program for extending out the invitation. It's my pleasure to join you today to speak to a topic that is near and dear to my heart, and that is balancing inequities. You have a wonderful topic, envisioning equity, addressing healthcare disparities through local governments. And so my first question would be, how do we get there as we look at what equity should be in healthcare? What is the road that gets us there? So if I look at it first, I defined health equity. Where are we going? Health equity is achieved, and if I could, Sarah, first slide, I'd like to share just a short presentation with you to help you get through my discussion and for you to find it interesting. If you're like me, I like visuals. And so again, thank you for such a wonderful topic, envisioning equity, addressing healthcare disparities through local government. And how do we get there? Paving the road to health equity. Next slide. Health equity is achieved when every person has access to his or her full health potential. And the barriers of economics, environment, and education do not create disadvantages. And those are normally the barriers toward equity. Health inequities are serious because they are reflected in a person's access to treatment. This may in turn cause disparities in one's quality and length of life, occurrence and severity of disease, disabilities, and death. Thus, health disparities or inequities are types of unfair health differences that are closely linked with social, economic, or environmental disadvantages that adversely affect groups of people. So what does health equity do? It strives to eliminate these health differences in order that all people are able to be as healthy as possible. Next slide. Health equity is achieved, health equity is achieved through quality health care, which is how most of us receive our health coverage through employment-based insurance. According to a report prepared for the U.S. Census Bureau, in 2019, 8% of people, or just over 26 million, did not have health insurance at any point in that year. What we found is that private health coverage covered approximately 68% of individuals, with public coverage being such as Medicaid covering 34% of people and 20% of people recorded that they were on Medicaid. So if you look at that, the majority of us receive our quality health care coverage through our employer, which makes quality employment a very severe topic. Some of the barriers to quality health coverage can be our finances, the job that we hold. It can be the environment, the places in which we live, and directly tied to our employment, the education that we have received. And so for the next few slides, I want to show a contrast by zip code of how those differences truly affect across that spectrum, how economics and education and environment affect us across McLennan County. So 76704, and if you look at that, that is predominantly, that is East Waco, where you can see that the aggregate household income is right at $91 million. The median household income is $21,398. And that area is 70% African-American, 9% white, and right at 21% Hispanic. There are 72% of the children, peoples 18 and younger, living in poverty in that area, with seniors 65 plus living in poverty, 19%. 84% of the individuals in that area have received a high school degree or higher. 7% have obtained a bachelor's degree or higher. If you go to the next area, 76707, that is in the North Waco area, so over there by the old Providence Hospital. And what you see is there's an aggregate household income, it ticks up $226 million, with a slightly higher median household income of $29,235. 27% of the individuals in that area are African American, 21% are white, and 51% are Hispanic. There are 46% of the people that are 18 and younger are living in poverty, with seniors 65 plus living in poverty being 25%. 68% of those individuals have acquired a high school degree or higher, with 14% having a bachelor's degree or higher. If you go a little further across McLennan County to the next zip code, 76643, and that's the Hewitt area. It has an aggregate household income of $468 million, with a median household income of $72,000. 6% of the individuals in that area are African American, 69% are white, and 19% are Hispanic. Individuals 18 and younger, children living in poverty in that area are 11%, 65% of the individual, 65 or older seniors in that area living in poverty come to 2%. 93% of the individuals living in that area have obtained a high school diploma. 33% of those individuals have a bachelor's or higher degree. The next zip code, 76705. It has an aggregate household income of $584 million. That's a very broad area, because that does not only encompass Belmead and Lacey Lakeview, it also goes out into the rural area, and it picks up Hallsburg, and if you go north, it picks up Golson. So a very broad area. It has a median household income of $44,338. 18% of the individuals in that area are African American, 51% are white, and 28% are Hispanic. 31% are children 18 and younger living in poverty. Seniors 65 and older living in poverty in that area, 9%. 79% of those individuals have obtained their high school degree. 13% have obtained a bachelor's or higher. The next zip code is 76708. And you will see that that is Bosqueville out by Spiegelville. And it goes into the tip of Waco. That area has an aggregate household income, $655 million plus, has a median household income of $51,000. 14% of the individuals in that area are African American, 47% are white, with 35% being Hispanic. Children living in poverty are 24%. Seniors living in poverty are 14%. High school grads are 81% of those individuals have a high school diploma. 22% of them have a bachelor's degree or higher. And our last slide, the next zip code is 76712, and that is Woodway and the Spiegelville area. This is the highest aggregate household income statistic in McLennan County, right at $927 million, with a median household income of $71,000 plus. 8% of those individuals are African American, 72% are white, and 15% are Hispanic. Children living in poverty are 6%, and seniors 65 and older living in poverty are right at 4%. 94% of these individuals have a high school degree or higher, and 45% of them have a bachelor's degree or higher. You go to that next slide. If you take that and bring it together, looking across McLennan County by way of zip codes, and I put it on just one slide where you can compare those, what you are seeing is that those areas with the lowest wages, which can be attributed to also the poor job benefits, also contend with high poverty rates. And this is probably attributable to and underemployment, as well as under educated. And so these are areas we continue to grapple with when it comes to health and wellness. This becomes a concern when you realize that employment-tied insurance is the way the majority of us receive quality health care. So to address this as a policymaker, my impact comes through policy, program development, and collaborations. And we can go to the next slide. We can go to the next one. Okay. So again, as we started, how do you get to the goal of health equity? What does that road or that walk look like? Achieving health equity through law and policy. One of the programs that we have enacted here in McLennan County is the County Indigent Health Care Program. Chapter 61 of the Health and Safety Code establishes the County Indigent Health Care Program. The program was created to help low-income Texas residents who don't qualify for other state or federal healthcare programs have access to healthcare services. And as you can see from the slide, those are a list of some of those services. Who's eligible for this program? Anyone who lives in Texas, has an income level at or below 21% of the federal poverty guidelines, has resources less than $2,000, and they are not eligible for Medicaid. Okay, the next slide. The Waco Family Medicine is a federally qualified health center, or FQHC, which means that it treats underserved populations. It uses an income-based sliding fee scale, and they provide comprehensive health services and qualify for enhanced reimbursement from Medicare and Medicaid. The center provides health care to underserved residents of McLennan County and also Bell County. Their clients are those who have historically been locked out of a healthcare system that favors privately insured patients. However, on a great note, they serve just under 60,000 patients. The center provides integrated medical, dental, and behavioral health care services across 14 sites here in McLennan County. In addition, Waco Family Medicine addresses social and environmental barriers to wellness through innovative programs and community partnerships. They also seek to make advances in the number of minority doctors that service our community. And through their residency program, the center trains family physicians with an emphasis on compassion and culturally sensitive care. The center was established in 1969 by the McLennan County Medical Society to address the shortage of doctors and the lack of primary care access for low-income community members. And it was developed from a coalition of business, political, and medical leaders. Next slide, please. And last but not least, as a local public health organization, the McLennan County Public Health District serves members of our local community. It is administered by the city of Waco, funded by McLennan County and most of the surrounding municipalities within the county. And we are lucky today that the director of that center, Ms. LaShonda Mallory Horn, is on our call today. If you have any questions in regards to that delivery service. Is authorized by Chapter 121 of the Health and Safety Code. Public health at the local level is characterized in 3 forms, and McLennan County utilizes the Public Health District form. And as you can see from the slide, they do provide a variety of services, and the majority of their clients are normally low to middle to low income. Next slide. Again, local leaders and elected officials can affect public policy to impact equity and balance. One of the economic development tools that we have used to give us space in health equity is the Waco McLennan County Economic Development Corporation. It is an example of exactly merging collaborations together for a common public purpose. Large employers are recruited to McLennan County, and in order for them to receive economic development incentives, they agree to hire employees at a base pay of $15 and also provide health care benefits, which ties us back to the fact that the majority of us receive our quality health care through our employer. So as I close, as defined by the U.S. Department of Health and Human Services, health equity is the attainment of the highest level of health for all people and can be characterized as action to ensure all population groups living within an area have access to the resources that promote and protect health. And as with all issues that impact our most vulnerable populations, it is an ongoing challenge. Mother Teresa said, "We ourselves feel that what we are doing is just a drop in the ocean, but the ocean would be less without our missing drop." And that is so true, especially in the work of balancing inequities. Again, I thank you for the opportunity, and I thank you for your time.
Thank you, Commissioner Miller. We appreciate your reflections on health, moving toward health equity in McLennan County. So I want to introduce my partner in this work, Dr. Lauren Barron, as we open up for our panel discussion.
Hello, everyone, and thank you so much, Commissioner Miller, and thank you, Dr. Body. We're very excited to have this constellation of our civil servants with us today to talk about this very important issue. And I have the honor of introducing our panelists today. So let me first introduce Deidre Emerson, who launched her career in public administration in 1995, serving Fort Worth. And she started in Waco in 2015 as assistant city manager. And she's provided leadership for so many departments. I'm losing track here: water utilities, public works, the library, general services, the convention center, visitors bureau, parks and rec, the airport. She's done it all. And she's been promoted to deputy city manager. And she's leading efforts on equitable strategies and economic development and process improvement. And she also oversees a huge set of city services right now: the Health District, Waco Transit, Community Services, Office of Neighborhood Engagement, and the Prosper Waco Collective Impact Initiative. And not only that, but the Creative Waco contracts. That's a lot. That's a lot of things. And she's an alumna of Dillard University in New Orleans, Louisiana, where she got her BA in Business Management. And then she had her Master of Business Administration from Texas Wesleyan in Fort Worth. So that is Deidre Emerson. And I'm so happy that we're having this event for the Waco community at large, but I'm excited that I had a chance to meet you through this too, meet all of you through this too. And now let me introduce LaShonda Mallory Horn. And she's dedicated herself, I love this, both through her professional and service life, to make the healthy choice the easy choice. And boy, we know that is not always the case. She's director of the Waco-McLennan County Public Health District. Before she came to us, she served in Northeast Texas for 4 years as communicable disease program manager for Texas Department of State Health Services, Public Health Region 4 and 5 North. And in 2003, she had her Bachelor of Science degree in Health Studies at Texas Women's and her Master's in Public Health at Still University. And she's also a Master's Certified Health Education Specialist. And we are just delighted to have her here at this amazing time in history with COVID to help shepherd our community through. So we thank you both very much for being here with us today. We have such an esteemed collection of specialists and experts here, and your personal and your professional expertise. We want to throw out some questions to get the conversation started. And the first thing I would ask, I'm a physician at Waco Family Medicine, in addition to where I did my residency. I'm so grateful to have that residency program here, and the Waco Family Medicine is just an amazing place. But I'd like to know what our panelists' perceptions or impressions are about the number of minority healthcare workers we have in Waco. And we know that it's not any one sector's job to solve this problem, but how can different agencies work together so that our representation in the healthcare professions matches the representation of the patients that we serve?
Thank you, Dr. Barron, for that wonderful introduction. And thank you to Baylor for the opportunity to be a part of this panel. For over 18 years, I've worked in hospitals and for-profit healthcare organizations, nonprofit healthcare organizations, even corporate settings, poultry processing for wellness initiatives. And what I found is that a lot of times the representation that's missing is at the physician level. At the University of Texas Health Science Center, I was the residency program coordinator for occupational medicine residency, but we also have family medicine and internal medicine residency there as well. And one thing that we saw often is that there were so few Black American resident physicians. We saw a lot of continental African residents, but we didn't see very many Black American resident physicians. So a lot of times those continental Africans had a hard time understanding the Black American experience because it's a little bit different. So even though they were Black people, they necessarily didn't have the same Black experience as some of the people that they were serving. And I think we probably would see that here in the Waco community as well. The majority of the physicians that I've met that have been Black here in Waco have been continental Africans. And because of that, their experience, their lived experience is a little bit different. They're immigrants to the United States rather than forced immigrants through the slave trade or whatever means brought our ancestors to this country and this community. So the experience is just a little bit different. So the one thing that I would love to see happen is if somehow we can lean heavily into these high schools and really encourage young Black men and women, high school students, to really look at medical school as an option, an attainable option, because it is an attainable option. But if you haven't been presented that, you don't think it's attainable. So I think that it's our responsibility to create the solution to the problem. Here at the health district, we train a lot of students, a lot of public health students, and we really enjoy doing that. But it would be great if we knew that we were going to be training students that are from this community, that are going to work in this community, because the majority of the students that we train are Baylor students that are just here for a time. So I don't know if we need to start working with Waco Family Medicine and some of the foundations to put something in play with the school districts, but we really need to make sure that our kids understand the importance of coming back home and doing work at home. That's why I spent those 15 years in East Texas doing work at home, because it was really important for me to pour back into the community that gave me everything that I am. So that's really what I would think would be one way we could address representation in healthcare, especially on the physician level.
Thank you, you all, for the opportunity to serve on this panel today. One of the other things that I would kind of piggyback along what LaShonda just said is that in the recruitment process for residents. And so when our hospitals or Waco Family Medicine are looking for those residents, we have to go to where those students or those are of color to come into these programs. And so that we have to make the intentional effort in order to bring individuals into our community. There are a number of African-American or predominantly African-American medical schools that that we should be tapping into if there's assistance that needed with that. I mean, because one, the thing that overall impacts us when we are, from a city perspective, when we're looking at from an economic development standpoint, and we're looking at bringing in businesses into our community, and we want those businesses, but we also need to make sure that we have the support services to support the families that they bring along with them. So if there's some collaboration that may need to happen between our economic development partners and our medical partners to make sure that we have created the environment that we want for our community.
I would just add, I've been in Waco for the last 50 years. And so one of the things that I saw when I first came to work for Commissioner Gibson, back in the late 1990s, there was one African-American physician here, Emsley Davis. And when he accepted better opportunities somewhere else, where that left us with no doctors of color, and the county, the city of Waco, and the hospital systems came together and held a meeting at the East Waco Library, because the clinic on Elm Street had not been built yet. And what they committed to was the recruitment of African-American and minority doctors. I have seen over the span of those 25 plus years that what we hoped would happen is happening. Could it be faster? Possibly. But to have gone from none to where we are now shows that that collaboration worked. And I think as we move into the future, we just need to stay mindful of keeping those solutions that have yielded us positive results.
Thank you so much, Dr. Body.
Yes. Yes. So our next question, really want to return to some points that Commissioner Miller mentioned in her presentation, and some of the threads that we've heard in our first answers about the investments. What kind of programs are you aware of, additional programs are you aware of locally that are making headway in advancing equity in healthcare? And this would include those that are also increasing minority representation in healthcare.
Deidre, you want to go with that one?
Yeah, I was gonna let you guys go since I kind of touched on it in my presentation.
Well, if you're asking about increasing representation in minority healthcare, I mean, I think it's more of the ensuring in the recruitment process, actually knowing the data, not just our own personal, our community data, but knowing the data of where the people are, watching kind of the education statistics and what's happening out in the universities, what is changing, what are the dynamics that are changing there, so we can make sure that we are intentional about that recruitment, so that we are increasing our population and or that what we have, our representation within our community. We have to know what's out there. We can't just continue to know what we have and what we don't have. We have to understand that, and then understand why don't we have it? What are there things or are there amenities that we don't have in our community that prevents us from having the representation? Are there other factors, things that we need to do to improve or change that?
I agree with everything that Ms. Emerson has said. Again, I would just kind of like to drive home. We have some programs in place that I would match with peer counties across the state and across the country. One of the, I guess, areas of lack has been, especially for vulnerable areas that show health disparities, where those individuals in that area have poor health outcomes, is education and a focus on wellness and preventive care. And when we look at that arena, I think our Waco Family Medicine just has some phenomenal programs that they have initiated. And I know Dr. Barron could probably speak to this better than I could, but I do think we need to toot our own horn. And again, I say, can we get better? Of course, it's always an ongoing process to get better. But we are starting ahead of the curve in comparison to other communities. And that educational arm is really reaching out into the community, especially when we talk about the programs for prenatal care of young mothers, where we're teaching young mothers to just even understand their bodies as they go through their pregnancy, and then how to care for and hold and treat their babies, and then nutrition. So I think Waco Family Medicine is doing a phenomenal job. I think our indigent healthcare program is an excellent program when it comes to providing health care coverage, especially severe acute care for individuals who just don't have the finances for it. And again, the arm of education that you get in our public health district cannot be underestimated, nor can it be minimized, because it is crucial for the population that they serve.
All right, thank you all so much. I don't know how often all of you get to be in the same room, but it's really wonderful to get to listen in on your thought process and all of your experience. Let me ask about because I've spent my career as a physician seeing one patient at a time. And so that's why I'm so happy to hear different perspectives where you have the overarching view. And I'm wondering if there are overarching foundations or initiatives that speak to the issue specifically of the lack of representation in the workforce. I'm wondering if you're aware of any foundations or kind of big picture initiatives that could help us, particularly in Waco, to connect the dots so that we can help have more, like you said, grow our own doctors who are right here in our community and get them back here to us. Do we know about anything that we could emulate?
So one of the things, Dr. Barron, that we have spent some time with in the city of Waco is through ICMA, which is the International City Managers Association, has a fellowship program. And so we have begun to create our own fellowship program within our city structure. We want to do two things with that. One, we want to go out and recruit young public administrators to come into our organization, as well as we want to utilize and or grow individuals within our current organization to put them into those fellowship programs so that we can train them, they can learn about the city organization as a whole. And so then that we are growing our own through that process. So, quite frankly, through the city, through the collaboration between the city as well as Waco ISD, they have a summer intern program. And so we have have had the opportunity for some of those summer interns to grow into full-time positions here with us within the city of Waco. And so through part of that fellowship program, the individual would have the ability to go and work in all the departments within the organization. Not every department is going to be the best fit, but the best public administrator is one who has experience and knowledge of how the system works. Once you understand and know how the system works, then you have the ability to understand and know how to provide the best quality services to the citizens, so to our community as a whole. And we have to really be, we've been really specific and focused on identifying African Americans to come in and work and go through that fellowship process with us. In fact, we hosted some interns from Baylor last year that we actually there's some that we specifically asked to come back because they were brilliant in helping us identify and work with us through some process improvement issues that we were having. For instance, I think we actually shared one with the health district, and we had shared one with our planning department to work through and look at what our permit process was so that we can provide, one, good quality service, and then two, make sure that we're providing the right service that people need, not just a service.
Thank you.
So here at the Health District, Dr. Barron, we're doing something pretty exciting. We got some funds for workforce development just for public health positions. Public health has been grossly underfunded and understaffed forever since I've ever worked in public health. But one thing that the pandemic really showed us is exactly how understaffed and underfunded we were. And with these crisis co-op funds, we've been able to establish about 10 new positions that are going to expand some of our current services and then add to what we already do. One of those things that we're going to do also is a public health fellowship. And the reason why is because one thing that we know is that the graduate assistant experience that the 6 Baylor GAs get from us for 2 years is very unique, and it's so impactful in their next steps in their career. But all those students don't get that opportunity. But there are some students that have finished the MPH who didn't get to do the GA program with us or process with us, or they may even be postgraduates from a PhD program or a Dr. PH program that could really benefit from a deep dive into public health and understanding exactly what happens in the public health department. Everything from the work that I do as an administrator to the work that happens, in our STD HIV departments. So it's important that we provide these kind of opportunities and experiences for students so they can see exactly what they're getting themselves into. I think we all go into our undergraduate experience with an idea of what we expect to happen later on or for the rest of our lives. And I remember being 26, walking across the parking lot at a hospital and thinking, I can't do this the rest of my life. And I love the job I was doing, but I was just like, there's got to be something else. So I think that it's important for us to be able to expose young people to all that something else as early as possible, but specifically to address the issues around disparities and equity in our workforce. We also are doing some real deep dive in-house training on equity and making sure that our staff understand to treat every person equitable and offer people exactly what they need when they show up, rather than I offer Commissioner Miller. There's that same thing I would offer Dr. Barrett. They may need two very different sets of experiences just based on where they are in their lives, and not even when it comes to age or gender or race or ethnicity. There may be some deep underlying things that we need to address. We work a lot with our LGBTQ population, so we need to make sure we're offering equitable services to that population, and those services being not what we think they need or based on our own personal judgment, but really based on what the people need right in the moment. So it's going to take training to make sure we get to that place, to transition our minds into an inclusive mindset where we understand that that everybody deserves the experience that we want when we go to obtain care or services.
Thank you.
Okay, great. So that brings us to our next question. So many of us have really been rethinking so many things about healthcare as we are continuing to go through the pandemic and see these disparities in health, differences in health outcomes in new ways. So given where you are in your role in government, if I were to ask you to think about 5 years from now, you had the opportunity to write the headline for the Waco newspaper, what would you write to really show how local government can change the narrative around healthcare disparities that really move us forward in health equity?
I got to go first on that one, considering I'm the health department. So I think really it would go back to what Dr. Barron said in my introduction, to make the easy choice, the healthy choice, the easy choice. I think that's attaining equity for everybody. When people can easily access healthcare, and not just sick care, but the preventive services that are so important, the educational services that are needed. So I feel like the headline would be, the Waco-McLennan County community is Robert Wood Johnson's healthiest county, Robert Wood Johnson Foundation's healthiest county in the state of Texas. And that's because there are equitable options. Transportation isn't an issue. Housing and food security is attained and achieved. All those things that make up a person's whole well-being, they have access to those things, because we can have the best healthcare, the best hospitals, the best physicians. We can have all of that, but if we don't have those basic needs that people need, we still fall short. So I think in 5 years, I would love to be able to say that that's where we were. I think Edward Warren, Deidre giving me a big fat high five and maybe some more money too. So.
Well, I mean, I totally agree with you. I totally agree with you, LaShonda, because, I have desires and visions for us to have in a number of communities. They have neighborhood empowerment zones, and I really want to see us have a healthy neighborhood empowerment zone. And so within that, the benefit of me serving in the role that I serve in is that I have the opportunity to have responsibility for our housing department, code enforcement, the health district. Those are all, that's just a sampling of that, but all of those departments have the ability to work together to ensure that we do have a strong, healthy, sustainable community and neighborhood. I mean, there's not one thing, not one event that either one of those departments has that the other department isn't there. So they are support for each other, because when we, even from a code enforcement, and we really wanted that to be focused on code compliance, oftentimes we see a lot of mental health issues through code enforcement. They don't want to live that way. But they have some mental health issue. So our code officers have the ability to make referrals to the health district and or to our housing department to help individuals access the services that they really need. So then we are in a position of doing code compliance, and not just the people seeing the enforcement side of us all the time. So, I mean, we do have to enforce our rules, but there's also things that we can do to make sure that we're providing support, because we do want to be that healthiest community ever, and specifically in Texas. And so we want to be the best practice. We want to be the model where others come to us to see how did you do that? What did it take? it takes a lot of work, but it also takes a lot of collaboration. And we've seen that as a result of the work that our health district EPIs have been doing in regards to our lead is preventable program. And so we take the data from that our epidemiologists provide us, and we are being focused on where we are directly advertising and or providing services. Now we serve the entire community, but we're being real specific about that because lead is an issue. We know that how that impacts the mental health and education ability of a number of our children. So we want to make sure that our housing department is paired with our health district so that we are getting the right data. So we're providing services in the right places, and not to exclude anyone, but we want to make sure that we hit those high impact areas first.
Yeah, I think it goes to using the data to drive the programming and the work. And I've worked in public health for years, and a lot of times we just did the work that the money was provided to do. And over the last probably 10 years, you start to see a shift where the funders wanted to know if you had any data to support the work that you were proposing to do, rather than here's $100,000 to do a church-based, initiative or something like that. So really, our EPI team is really good about digging deep into the data, looking at what is and isn't. And sometimes I've been wrong on what I thought is, and I've asked Vidahi, like, I think this is where we need to go. And she's like, oh, actually not, because if you look at the data, it shows us differently. So, and it takes a lot to step back and know that you're wrong, but it's important to make sure you use the data to drive the work, because that's what's going to get us to that healthiest county in the state, and not Denton County all the way down. So,
and that data, along with our funding sources, making sure that we are being creative within the compliant. We want to be compliant, but we want to be creative in how we utilize those funding sources, because we all know here in Waco specifically that many thousands of our housing stock was built before 1978. And so that those are all lead homes. Specifically, the highest populations for that is in council districts 1 and council districts 4. And so we have really worked hard to ensure that we are looking at the housing, 1, the housing standards, and then 2, what can we do with our funding sources to support that? Because that brings up, when you have a safe, healthy place to live, then we know that education outcomes are better as well. And so we want to make sure that we have good quality, sustainable neighborhoods for our children and families to live in.
I appreciate you saying that. I have recently been seeing an infographic that really caused me as a physician to have a lot of humility. And it talks about how in terms of well-being, only 20% of our well-being is attributed to the healthcare system. There's so many other things, the social determinants, our environment, our health behaviors. And so a lot of times, at least in our training in medicine, we can get very focused on just our specific arena. But the older I get, the more I see how important it is for us to work together. And I also have to tell you, I had a mentor who said, anybody can work harder. And what he meant was, just because you're working harder doesn't mean you're getting more done. You got to look at the data. It made me think of him when you talk about looking at the data, because we can do all kinds of things, but have to have it, driven by the data. So, well, let me ask another question that comes in from Professor Chris Houston from Waco Family Medicine, and she's asking about ways to coalesce all of the different medical facilities and medical, institutions and organizations around this idea of recruitment for representation. So nursing, pharmacists, dentists, psychology, social work, there are all of these different healthcare professions, and we have, different clinics and hospital systems. Is there a way that you can see that effort converging, I guess?
I think there's a way for that effort to converge. I mean, there's opportunities for, I think LaShonda mentioned a little bit earlier in regards to, we have graduate assistants within the health district, and we have the ability to work. And I think it's a great opportunity for those students to come and work, kind of create a continuum. So you're in the public health district, and so you get to understand the community and the community needs and the woes, the ills of the community. And then as you progress throughout the rest of that residency program into the actual medical facility, I think it just means we need to come together and pull that program together. We can create our own. Even if we haven't seen one, we know best of what our community needs. And so looking at that data, pulling it together, and who has that expertise, let's just go get it.
So, and I think that one of the things that was really impressive to me about this community when I came here in March is the collaborative effort in the healthcare system to see competing hospitals work hand in hand with FQHC and the health district to try to get to a common goal. It was impressive. That's not how it works in most communities. So I think that Waco and McLennan County is unique in that way. And I think it's just an expansion of that, keeping those conversations going and then starting to talk about what exactly does our healthcare system need, or not even our healthcare system, what does our community need as far as representation within the healthcare system? And I think one thing that we have to understand is that right now is not the time to, in my opinion, to shift into trying to do a big deep dive recruitment effort, because people are tired. And I think we're really just trying to maintain what we have right now. So I think if anything, really, how can we keep our staff, public health, nursing, any essential workers and support staff, how can we keep them in a place where their mental health is stable, the burnout level is low, and we're able to keep them working at the level that we need them to work at in order to be productive for all of our community members. So I really think that the efforts that this community or the things they put in place back in March at the start of the pandemic are still in place. And those conversations and those meetings are so not what I've experienced in other communities when you have competing institutions and organizations on the phone. And it's very refreshing to know that the main number one goal is to make sure that the people in the community are taken care of. So it's really great to be a part of a very special community like that. So you guys should be proud.
So thank you for your responses. So what kinds of ways are you engaging the community to be more involved in shaping the healthcare system? Particularly, I really like the way you're talking about make the healthy choice the easy choice. So how do you engage the community so that they are really helping to shape those opportunities that can inevitably make these healthy choices the easy choices, or to help our health system be more aware of some of those challenges that may not be as visible or as
Well, there's 7 competencies in health education that we typically work off of. And the first 4 are the ones that we think the most about them. The first one being the needs assessment, the second being program planning, implementation, and then lastly, of course, evaluation. So this is the year traditionally the health district would have really leaned into doing a community health needs assessment, but because of COVID, we opted to push it back a year. But I think that's really what we're going to need, is to have our community give candid, direct input during the community health needs assessment process on what they need versus what we think they need. One thing we know about the CDC impact pyramid, at the very top of it, the little bitty point at the top of the pyramid is direct services. Those are health education classes, chronic disease self-management stuff, all the things that health educators and our health education staff does a great job of, but it only hits so many people. When you get down to the very base of that, that's just who we are as people, our socioeconomic status, and right in the middle of that is policy and opportunity that can be developed by leadership. And I think really it's going to be important for me to serve as a liaison between a traditional education team and, those people, just who they are, to help try to get those policies moved into a place where they are going to make the healthy choice the easy choice. working on our built environment. You know, all this construction that we see around town, that's to see sidewalks being developed, that's a great thing. Yeah, it makes it look pretty downtown, but it makes our city more walkable. You know, working with transit to make sure that the buses go to the places people need the bus to go to in a timely manner. You know, so the built environment is going to be really important for that. And then also, like I said, just making sure we keep working at the top of the pyramid, but think about those things deeper down. And when addressing equity specifically, thinking about bias, unconscious and conscious bias based on how we engage. It's thought that the health district is the poor people's health district, and the health district is the health district for all people in our community. And so, you know, making sure that we change the bias that the community has about the health district, and even about like Waco Family Medicine, for instance, like it's the low income clinic. No, it's a FQHC that can serve anybody in the community. So it's, you know, there's a lot of just conversations that need to be had, a lot of education that needs to be done. But in my opinion, the main thing is really breaking down some of those biases and trying to impact the policy the best we can.
Or a class that Dr. Body and I teach together at Baylor University for pre-med, pre-health, and social work students. It's about disrupting racial disparities in healthcare. And we've been having some conversations with GWACA, with the Greater Waco Advanced Healthcare Academy, really excited about what we might be able to do to have students that we have right now turning around and mentoring. I think there's some doctors in our high schools right now that could be doctors in our community that we need to find them. But one of the things we're learning is that there's just a huge economic barrier to entry into the next step. That's what concerns me, is that a lot of potential students have to work. You know, they have to work, and the cost of that next step in their education is a huge barrier to entry. And I just wonder if there are any ideas or abilities or funds that we're aware of that can help get high school students to that next step.
Well, I would highly recommend, one, we have a great university center here in Waco and at McLennan County Community College with their partnership with Texas Tech, as well as Tarleton. And then those students who are have the ability to go through the MAC Foundation, the MAC program, and receive those scholarships that's being managed through Waco Foundation. That's a great opportunity. And the students also, I would suggest that they look at doing the dual credit program so that they are receiving that credit as they are going through high school, recognizing that some students do have to work when they are in high school, but it's doable. And the other thing that we have to realize is it's not paying less. It's not a paying less process, but we're going to go through some pain and some struggle to get to where we really want to be. And it does take some hard work in there. But we have a great university center that provides individuals to even live at home and get through the first phase of that college experience. And so then they are preparing themselves for that next step. And that's at a reduced cost. If they want to stay home, they have the ability to do that. So I would definitely make sure that students are having conversations with their guidance counselors on potential scholarships that are available, having conversations with the NAACP, and understanding, knowing what resources they have available for students to engage in, and just seek those folks out. Call me. At the city of Waco, and I mean, if we have to help, then we're willing to make that help. I mean, it's not okay for us to watch our students have a desire and not help them achieve it.
I think mentorship is really important. I had some great mentors as a child, and people that just poured into me so much. And I think that while everybody's family structure looks different, it's really important that we don't make kids feel less than because their family structure looks different. But if you see a child who is bright and has potential in any field or area, even if it's not something that you're necessarily interested in, I think we owe it to give back and to take time with people. Shirley Chisholm said that service is the rent we pay for time on this earth. And I think that, part of that service is being the service to people and, mentoring people. I think that that's one thing that is sometimes missed. A lot of people that are physicians, probably right here in our community, had a hard path ahead. I mean, I'm not a physician, but I had a hard path ahead to even get through graduate school. Shoot. So, I think, my experience, I feel like could be a help to some young person. And I try to do that even with our GAs or even with my younger professionals here in the health district, just to encourage them to, keep striving and, provide them whatever support that they may need. So.
Dr. Body, I don't know if you saw this question that came in from Bill Blackburn. Bill Blackburn, we have the mayor of Kerrville with us, and he's a member of the Board of Advocates for the Garland School of Social Work, and he is asking a question that I love. And what he's saying is that you've done so much, the three of you have done so much to bring resources together in Waco and the county. And he'd like to know and he's the mayor of Kerrville, so he's wanting to know ways that you've been able to generate so much collaboration and showing the public how the community is a system. So what are we doing right that is generating this kind of collaboration?
I would say it's the heart that our community leaders have for our community. I've been in Waco for 6 years now, and the community leaders have come together on several fronts when it comes to whether it's something good that's happening or something bad that's happening. They've come together collectively in regards to race equity, with that work being led by our Waco Foundation and Cooper Foundation, in ensuring that our leadership throughout the community is provided the opportunity. Now, whether they take advantage of it or not, but they are provided the opportunity to learn more and dig deeper into race equity so that we are providing and building a holistic community. And so I think our leaders have a heart for the community. And I'm not saying that any other community doesn't have that heart, but they know that it means that we may not get everything that we want, but again, it's not about us. It's about the community that we serve and ensuring that the outcomes are good outcomes. We've seen enough bad outcomes and we don't want to continue to repeat that. We want better outcomes. So we want to work together, have the communication, have the conversations, whether it's even that we're going to travel, that we're going to other communities and looking at examples that are being done there so that we know. And everyone can pick their piece. Pick your piece on because everyone has a lane, everyone has a role. And so we want to make sure that we don't overlap those, but we do want to make sure that we're having the communication so that we can walk the path together and so that we can have a strong community.
I agree with everything that Ms. Emerson has said. The only thing I would add, since I've been in public service, what I have seen is leadership across the county has come together on an ongoing basis. I can go back to 1995 when we have come together, county and several cities, and applied for grants to refurbish blighted areas in our city. I can remember, again, like I mentioned earlier, when we came together, the city of Waco, McLennan County, and the hospital systems to come up with a solution on how to recruit and retain minority physicians. It seems that from the initiation of our Vision 2000 to our Vision 2020 to our Vision 2040, there is a shared vision of what leaders want Waco and McLennan County to look like moving into the future. And if you have everyone on the same page, it's not hard to bring us all to the same table. And so what I would say is that you first find a common basis, And then you bring those individuals to the table and you make it known that although you're meeting incrementally whenever an issue or perhaps a subject arises, but it is going to be a strategy that you will always come together initially and try to forge out solutions across leadership councils and boards and commissions.
So our next question is from Jackson Griggs, and he asks, at the municipal, county, or state level, what policy, if adopted, or what existing policy, if eliminated, would have the greatest positive influence on health equity?
At this time, I'm very proud that we have a federally qualified healthcare center here in McLennan County. I appreciate the fact that Waco Family Medicine, the Public Health District, and Engine Health have decided to come together on an ongoing basis and see how it looks for that collaboration to continue to move forward on behalf of the citizens here in McLennan County. I don't see anything I would eliminate. I do know there have been discussions on the most efficient way to deliver public health. Is that a public health district? Is that a hospital district? Is that, again, a collaboration of the three programs that we currently have? And so I would say one of the things that I was glad to see, and I don't know if that necessarily has to be established in policy as much as practice, and that is the ongoing relationship with those three entities.
Anyone else like to chime in?
Well, it's not necessarily a policy. So forgive me, Jackson, or Dr. Griggs, but one of the things that our council has asked us to look at is to consider bringing forth a proclamation that declares racism as a public health crisis. And we are in the process of doing that. Earlier, LaShonda mentioned how the health district received a disparity grant, and we're taking our staff through some health, we will be taking our staff through health equity training as well as race equity training. And so, but in order to build upon that, when we look at the data, because we do, our city manager is, as well as ourselves, are really focused on what does the data say and how does that drive our work. But when we look at the data and how, when we look at what our housing stock is, what's happening within our justice system, how are our communities of color being impacted, and as well as the community as a whole. And we do know that racism is that. That is one thing. So we will be looking forward to bringing that forth to our council. But the other thing is, and we know that looking at how the systems all work together, as Commissioner Miller mentioned, what is the right structure? But there is a place for it all. We do believe that there is a place, because there's a place on how the public health district functions and operates, and the education level services that they provide, that a potentially medical facility would not necessarily provide that grassroots educational service. So I think we have more things that we would like to build upon versus eliminate.
If I could, I'd like to go back before we close out, especially in ending on a note of equity, on the question that you asked about what we want that headline to be 5 years from now. I think on the responses that we heard from Ms. Horn and from Ms. Emerson, that means that we can count on them to be here 5 years from now. But, and what they said is what I hope to see. I think we have a challenge in front of us. Texas is number 50 when it comes to health care coverage. We are a state that has elected to not expand Medicaid, when we know that across the country, 20% of people rely on Medicaid for their health coverage. When we know that more of us receive our quality health care through our employer, then we know that we have to have quality jobs. And when we look at those vulnerable areas, which are now racially diverse, if you go back to that zip code table that I created, minorities are the highest demographic in those impoverished areas, but they are culturally diverse. So you have all ethnic groups that are affected by poverty and affected by low wages and the lack of health care. So as we move forward in trying to level the playing field, in trying to provide equity care and quality equity care to all of the citizens of McLennan County, we do have to take into account that we're fighting an uphill battle, and it starts with giving everyone at least a fair shake when it comes to the jobs that they're able to acquire, and hoping that with that job comes health care benefits that provide them quality health care. I think when we get to that day, then we will see all of us able to reach our full health potential.
Thank you, Commissioner Miller. And also, I just want to thank you again for showing us the data that really does highlight for us these differences across the zip codes, particularly as we know that zip code is a better predictor of health than genetic code. And so given that, I would like to reframe a question that has already been asked. So we saw zip codes like 76712 that has high incomes, high educational attainment. So how do we bring our other communities closer to the success and the advantage that we see in communities like 76712?
I know at one time there was a collaborative committee of the county, the city of Waco, Waco ISD, Baylor University, MCC, and TSTC. And they looked at how do those various environments intersect with one another. I think it's going to take collaborations of that level. We're going to have to strengthen and gird up an educational system that truly educates our children across the county and prepares them for post-secondary education and prepares them to enter into the workforce at the levels where they can obtain those jobs, where they can earn those wages. It's going to take collaborations again with GWAMA and then the other academy that was mentioned earlier, the healthcare academy, partnerships with MCC and TSTC. As we move into the future, we already know that our kids are going to have to be educated past the secondary level in order to obtain those jobs that come with the wages, that come with those quality benefits. And that's the only way that we're going to see the strides that we need to see in those areas. If we don't change the educational attainment, then we're not going to change the educational level. And if you don't put a dent in both of those, then we're not going to put a dent in what people are able to bring home as wages and also to have as benefits, especially again in a state that has decided not to expand Medicaid.
Thank you all so much. Go ahead.
Can I add one more thing? I'm sorry. One thing I really urge us to all remember is that income and wages does not necessarily mean, no, that's not how I want to say it. What I want to say is, regardless of the wage, we can still teach people how to be healthy. So I do understand that whenever you have more means, you typically can make better choices. But I think it's going to be really important that we keep doing this high level education work that our staff does. Like our WIC program, I've been here at WIC all day and just seeing the work that they do. They teach cooking classes. They provide families with supplies to cook, not just this is how you do it. They give them knives, cutting boards, making sure all those things are available. So it goes back to my make the healthy choice the easy choice. Yeah, we would love for everybody to be economically on the same playing field, but I don't think that that's realistic. But I do think it's realistic for everybody to have the same knowledge and to change the mindset of a community. If the mindset of the community is that we're going to make the healthy choice the easy choice, meaning you don't have to go 50 minutes outside of your neighborhood to get this good for you something, then it's more likely to happen. So I think that that's why I love public health, because it's a huge challenge. The easy part would be able to say, let's pay everybody $100 an hour and then we all got money and life should be good, right? But the reality of it is that there's some underlying things that just don't happen in a capitalist society like ours, where we have to make sure people have the option and the opportunity. And that's what equity is. And that's why it's so near and dear to my heart. Because if I know that our WIT staff aren't just saying, this is how you cut up a pineapple to make this wonderful pineapple salad or whatever it is, and they say, this is how you do it, and I'm going to give you the tools. That's how you bridge the equity gap. Because if you don't give people the tools to do the work, they can't do it. You can give a man a fish and teach him to fish. It's all basic. So I think that changing the mindset of our community is going to be really important. I'm excited to be here and a part of this shift at this point. I hope that we can, for sure get more high paying jobs into the community. That's the economic stuff. I have no clue about how it all works, but I know it's important. But more than anything, making sure people have what they need to get to the level of wellness and life and health that they want to be at is what's really important to me. So sorry for interrupting you.
No, not at all. I want to give Deputy City Manager Emerson the last word here.
Well, I want LaShonda to share her walk and talks, because she means what she says. And so she wants to make the healthy choice the easy choice. And she's hosting walk and talks within our community so that they can come and hear about mental health issues, and they can hear things about the things that are impacting their lives. And so LaShonda, can you tell them a little more about that?
So I love to walk. I'm an avid walker. I've done walk organizing for an organization called Girl Trek that was started with a goal to get 1 million Black women to walk 30 minutes a day for self-care and wellness. So coming here to the Waco community, I believe Pat expects me to start a Girl Trek team or pick up a Girl Trek team that has started here. And eventually I'll do that. But one of the things I wanted to do was get a chance to meet some people in the community. And what better way to do it than take them on a walk and have a walk and talk. I did this with any of the staff here at the health district that wanted 15 or 20 minutes one-on-one with me, rather than just coming in my office and sit and talk. Let's go walk down the beautiful Brazos River right behind our building. So I'll have the first one next Thursday, and we can make sure that people understand where they're gonna be. They'll be at 6 o'clock, 30 minutes. We'll talk about mental health, the benefits of walking, some safe walking practices. There will be one on a Sunday afternoon at First Baptist Church after the Spanish speaking service, and I'll have a translator there at that one because my Spanish is really bad. But I think I'm going to hit all the rec centers in First Baptist Church. So the idea is just for me to get a chance to go and meet people in the community. I literally moved to Waco knowing nobody. And so it's other than the people that interviewed me. So it will be a good chance for me to meet some people, and my kids and I and our little dog will be out walking. So
that's
we
wonderful.
Hope some of y'all join us.
Wonderful, wonderful. Well,
I would like to make a clarification, just one, because maybe it was misunderstood what I said. When I equate the fact that in order to have health equity, we're going to have to level the playing field when it comes to job opportunities that are tied to quality benefits. And when I talk about education and how that's tied to how people behaviors. I don't want to be glib, because we have a lot of people languishing in poverty. We have a lot of people who are locked out of healthcare because they don't have coverage, but they're working a 40-hour job. And so if we are going to truly take a look at health equity How do we provide everyone with quality care so that everyone can reach their full health potential? We are going to have to take a serious look at how the jobs that people have and the benefits that come with those jobs. It wasn't so much the wage that they earn, but the benefits that come with those jobs, since we know that the majority of us receive our health care through our employer.
Absolutely. Thank you so much. Well, I've learned so much and want to thank you all. And we've come to the end of our time. And I want to turn it over now to Cuevas Peacock. And Cuevas is the Assistant Director of Community Relations and Cultural Wealth for the Office of External Affairs. And so Cuevas, it's all you.
Thank you, Dr. Barron. And again, thank you all our esteemed panelists. It was really a great event that we had. With Envisioning Equity, we have had a lot of great local, national experts to come and talk about various ways we can increase health equity and education equity and things of that nature. But this was probably my favorite one thus far because we had that local component to it. And as one of our panelists said, we know best about what our community needs. And so while we're engaging with people who provide additional information to us, really tapping in and reminding ourselves that we have a lot of great people here in Waco who are doing amazing work that we just have to get behind and support and figure out ways we can collaborate with them to kind of move things forward. That said, again, thank you to all our panelists. Thank you for everybody who decided to attend this afternoon. Coming up next, Kyle, if you can pull up the slide for me. Our next Envisioning Equity is happening on Thursday, October 21st, where we will have Dr. Renee Crenchlow talking about the ladder, which is a model for service learning and mentorship that addresses the need for minority representation in healthcare. So as we work to identify ways to diversify our local healthcare workforce, she has some great tools, some great practices that she has already put in place, and we hope to learn from her to do these same things locally. Lastly, I also want to share about our Go partnership. And so what Go is for all our Baylor family. It's a way for them to get engaged in the Waco community with our local businesses to unlock discounts, deals, and specials that you only have to have your Baylor ID for. And so again, be on the lookout for that next event happening on October 21st. And please continue to engage with our Go partnership discount program. And again, share this video, share this recording. We have some people who were or were not able to attend, but this knowledge remains the same going forward. And so you'll be able to kind of access our videos on our Baylor External Affairs website. But in closing, again, thank you all. Thank you to our panelists. Thank you to our attendees. Commissioner Miller said something that really stuck with me from, I think it was Mother Teresa, that while we are all but one drop in this large ocean of life, the ocean is a little bit lesser without our drop. And so continue to do your part in learning and moving forward our community. Thank you all again and have a great afternoon.